Diet is essential in managing both type 1 and type 2 diabetes because what we eat affects our blood sugar levels.
Oftentimes patients with type 2 diabetes are overweight or they're obese, so it's really important for them to lose weight. So in addition to eating healthy, they really need to reduce portion sizes, reduce calories.
What it really comes down to is knowing how many carbohydrates you're eating each day and working with a registered dietitian to come up with a plan that's appropriate for you, for your activity level, for your age, for your height and your weight.
Many people, when they are told that they have diabetes or they need to lose weight, think that skipping meals is a good solution. And it's actually not. It's very important that when you have diabetes, you eat regular meals.
Having a consistent supply of carbohydrate to the bloodstream is very important so that you don't become hypoglycemic or hyperglycemic.
So they need to learn the right portion sizes for different foods.
To build a diabetes-friendly meal, make half your plate non-starchy vegetables. Fill a quarter of your plate with complex carbs, such as whole grains or fruit. Fill the remaining quarter of your plate with lean protein.
In general, patients should eat more fiber. They'll stay full longer and eat less.
It helps to lower your blood glucose. It helps your digestive system. It helps to reduce weight. There are some foods that people with diabetes should try to avoid, like sodas, for example, or juices, any drinks that have a lot of sugar. Sodium is another food that we want to avoid. So if you're eating too much salt, it will give you, high risk for cardiovascular disease and high blood pressure. Fried foods just give you extra fat and calories that you don't need.
It was important to make changes in my diet. I couldn't eat regular bread and potatoes or rice and expect my health to improve. Once I've cut those foods out of my way of eating, I've seen a huge change in how I feel.
Diabetics can definitely still enjoy dessert, but they have to plan for it. So for example, if you always have about 45 to 50 grams of carbohydrate at each meal and you want to have that piece of pie, then you just have to kind of trade off other carbohydrates at the meal. So you can't have the rice or the pasta. It's like anyone with sweets. You're always making that choice. Do I really want this?